Hey, everybody. Welcome back to another episode of Interpreting in Healthcare, a podcast put out by the Standards and Training Committee of the National Council on Interpreting in Healthcare. And today I am really, really pleased to have someone that I've known for a very long time, whose career I have accompanied from both near and afar, here with us today. And let me tell you a little bit about Anita Coelho Diabate, who is a CCHI nationally certified medical and behavioral health care interpreter. She's also an interpreter trainer with nearly 20 years of experience in the field of language access. And for nearly a decade, Anita served as an IMIA executive board member in the roles of vice president, I think that's when I met you, and senior trainer, promoting national certification and giving workshops on a variety of interpreter-related topics throughout the US. Anita works as a full-time OPI VRI interpreter for the Cambridge Health Alliance, one of the best places to work in terms of their commitment and rollout of language access services in the country, I think, in a state-of-the-art call center in the Boston area. Anita continues to give workshops to both interpreters and providers on interpreter best practices within the medical field. So welcome. So happy
Thank
to have
you
you with
so
us
much.
today.
I'm very happy to be here, Eliana. Thank you.
So, like I said, we've known each other a long time. I think one of the very first conferences I went to at the Harvard Medical School, which everyone takes their picture, their selfie in front of those steps where it says Harvard Medical School, was when you were VP of IMIA. So, and I was thinking to myself, wow, what a great opportunity to be able to promote and advance language access rather than being stuck working just within one department. This reach, seeing all the interpreters that were there, really got me excited about expanding my participation beyond being a trainer of interpreters. So thanks for that inspiration, Anita. So looking
Absolutely. It was
all
a
the way
very
back,
exciting time. Yeah.
what sticks out when you look back? What are you most proud of?
Well, so I'm most proud of having changed my career. Sort of, I was approaching my 40s, and I um, I was in executive sales. The groceries were great, but the job was really sort of, it wasn't a skill-based job unless you're thinking about how skilled one can be in selling icebergs to Eskimos or whatever it is that people say. I don't mean that in any derogatory sense, but I'm just saying that, there are many expressions used to be able to say, that you can sell anything to anyone. Now, the problem with that career was that it's only as good as your last deal. And
Mhm.
that really didn't feel good because you had to keep striving and striving and striving. So I thought about what I could do. What do I know how to do that I could actually change up? And I knew that I spoke Portuguese. Now, I grew up speaking both Portuguese and English in my house. My father was a lit professor and my mother a librarian. And he taught Portuguese and Brazilian literature for the 19th and 20th century. So you would think that my Portuguese was pretty great. My English was stellar because my mother is a grammar police person. But
Mhm.
my father was busy teaching at Stanford and then on to another university. And so um, I thought, okay, I can speak Portuguese pretty well. And I talked to my dad about it, and he actually arranged to have me audit some courses at his university. So I went to the extension school here at Harvard and went and took beginning, intermediate, and advanced Portuguese before even trying to get into a place where I could go to school for interpretation. And I thought, wow, that could be a really exciting job. I looked into legal, I looked into medical, I looked into community and conference interpreting. And in the end, although some of the others were more lucrative, I didn't want to be in a place where somebody was always against somebody else. So, X versus Y, right? So I thought, human services is really a sweet spot for me. I'm going to do my best to, go to school and do that. So I spent the next couple of years going to school, learning all of the basics of interpretation and cultural competency and all sorts of things. And one of my teachers was Isabella Rocha, who is now Isabel Souza. And she was at that time, I believe at that time she was the president of the International Medical Interpreters Association. I went to school
Right.
with her for both clinical and behavioral health, along with Lisa Morris. She was also one of my teachers. Lisa Morris is with AHEC, the University of Massachusetts.
Right.
And so, long story short, I aced everything, flew through school. The school actually asked me if I would go and do their healthcare, mental health interpretation program, and financed me to do that. So that was amazing. And so out of the entire time, I think I got a grant from the state of Massachusetts. So I think I might have spent $35 on a book when all was said and done at the end of my education.
Woohoo!
Right. And so then one of my teachers at that time was setting up all of the internships. And I had my eye on Cambridge Health Alliance because I had met someone who knew someone who was in that group. So I went and became a temp for CHA and, cut teeth there, shadowed for two separate what do I want to call it? Preceptors. So I had 80 hours of precepting, which was amazing. And then I hit the floor as a per diem interpreter. 2 years later, I was hired as a full-time interpreter. And that's certainly one of the things I'm very, very proud of. Another thing I'm very proud of is using the platform as an executive director at the IMIA. I was able during the time that certification didn't even exist yet, that we were still talking about it. Cindy wrote was like, are we ready? That was her shtick at the time, right? And so I started going around the country talking about certification and getting people sort of jazzed about the idea. Now, for those who don't know, there are two separate bodies. There's the body that was initiated by the National Council, and there's the body that was initiated by the IMIA. So there is the National Board of Certification for Medical Interpreters, and there is the Commission from the
Certification
yeah,
Commission.
the Certification Commission for Healthcare Interpreters. So I chose at that time, because I was with IMIA, to talk about the NBCMI. However, as it turns out, and I will go on record as saying that really the front runner in admin, in proctoring, in all of those things ended up being the CCHI product. And
Wow.
all of the follow-up, all of the things. And we were catching a lot of the calls for the NBCMI, which is still a perfectly valid tool. The difference between the two is one is accredited and one is not. And so the accredited one is the one that I currently hold, which is the core certification in performance E to E. And I do so in Portuguese. And, it was an easy process compared to what I was hearing back in the day about how it was to work with the NBCMI. So when all was said and done, I chose to go, I chose to step down from the IMIA. I had been a board member for 10 years and sat it out for a while and then joined the National Council. Because I am a huge believer that any interpreter should be part of a professional association. That keeps you current with everything that's going on. It keeps you understanding what's happening in the field, and it is really a great way to network with people who are like-minded. Or one would expect that they'd be like-minded. We certainly all have our differences too, which are rich and wonderful. And so that was another really a thing that I was very proud of, to just sort of raise my hand and volunteer for that long, to advance the profession. That was a big deal for me, and I was very committed to doing that. In so doing, I became a trainer. And so I started teaching people. I started teaching people about telephonic interpreting and how that differs from being a face-to-face interpreter. I talked about mental health and how that differs from clinical. I talked about how to manage a very difficult situation when you've got expletives and all sorts of other things happening in the middle, smack dab in the middle of your encounter. Or what happens if things completely go off the rail? You know, how do you protect yourself? How do you keep everybody else safe? And those were some of the things. Medical terminology, not my favorite subject to teach, I will say. Rather dry, but fascinating if you really look at, like, you know, breaking it down by specialties, by anatomical systems. It can be really fun to play with. Abbreviations the same way. So that was really something. And I swore as a kid I would never be a teacher like my dad. And here I was teaching like my dad, and I really enjoy it. Now, I want to say one thing. So I told you that over 10 years ago, I started talking about national certification. But for years and years and years, there was no option for me to take the oral exam because it isn't offered in Portuguese in either tool. But then the kind folks at the National Council and CCHI got their brains together and said, you know, we could probably do a really good job in gauging performance in one language. So they developed a way in which we could actually have a performance exam that would show you the same tools and skills that any interpreter needs to grab from their brain in any language, by using one language to do so. So that was really exciting. Now, the reason that I took so long, and I just am newly minted as a core CHI performance interpreter, because I was, first of all, waiting for the oral tool. So there was that excuse. I didn't want to do one and then have study and all that stuff and then have to study all over again, because like any stubborn student, I felt like I want to do them both at the same time. And I know what I'm doing and I do it well. And so there, right? Well, the real core reason why it was tough for me is because I was deathly afraid of failing. And how could I fail an exam that I went out and taught all the material for and taught all these people that they should go and do it, and then I don't make it, right?
I
So
think that's why it's so important for you to share this experience, because there are a lot of interpreters that have been doing this for 20,
for a very
25
long
or
time.
more
That's
years,
it.
who say, oh, I don't need to, I know what I'm doing. And yes, they're mostly right, but fear is a big factor because you
So
think,
fear was
I don't want to
key.
fall flat on my face. So the fact that you face that fear,
And I will
kudos.
say that the commissioner for CCHI and the president of NCIHC both had to talk me off the wall so that I could get myself registered for this core exam in both the written and the oral. Now, another wonderful thing that I'm proud of is, in preparation for such a an experience, a sort of a blood-curdling experience, if you want to know the truth, which it wasn't when I actually did it, but it was that
When you
build-up.
actually went through, your fear expectation was greater than the actual experience, was
Absolutely,
it not?
absolutely.
Yes, listen up, folks who aren't yet certified. It's
So
all
true.
in your mind.
Well, there was a lot of buildup in my mind. You got a point there, and so I chose, and there were a number of other people on my staff, on the staff that I work with, because they're not my staff, they are my team, that also were afraid of taking the exam. And then all of a sudden, the kind folks at CCHI offered a grant to the CHA interpreters should they want to pursue the certification, and they would get a chance within 1 year, if they signed up, to do both the written and the oral test, and that was on CCHI. And how could you, I mean, we
How
have,
can you say no?
you can't say no. And I was always one in teaching people to say, look, always take an interview, even if you don't need the job or want the job, so that you know what's going on in the field. Always take an opportunity to have an education if it's given to you for free. Like, don't shirk that responsibility to yourself. But again, there was the fear factor. So I was dragging my feet a little bit. And so I decided that I would reach out to those folks that were interested in certification and offer a 90-minute course once a week to help them prep. Now, I had no idea what that would look like, and I didn't know what the test was going to be. So I had to do the same thing that I did when trying to pass the mental health interpreting exam, to try and figure out, like, what part of the DSM am I going to be tested on, right? And the DSM is a very thick manual for mental disorders. So yeah, it was a trip, because I was really trying to figure out, okay, as an interpreter, what are the core things that I need to know? Memory, note taking, all of these different factors, and never mind the actual medical terminology and all of the machinations that go into being the wonderful professionals that we are. And so every single week, and it called back down to 5 folks, I think, in the end. And at the end, and every single week we got together and we would role play, and we would talk about the challenges that we had, and we would do memory exercises, and and the thing that actually made the most difference for me, that I didn't know would make the difference, was to come up with different ways to say the same thing. So how are you going to synonymize? And that's not even a word. I made it up yesterday, or no, this morning in a meeting. But how are you going to make synonymous the same message? So it's a message to message profession, no longer a word for word like people used to say. But that message has to be right on point, as though it were fluid, as though it was being said by the patient or the provider. So, you can say it any which way you want to, but it's got to be the same thing. So we did a lot of that. And boy, did that save me, because there was a lot of that on the oral. So folks, if you're listening, really think about how you could say the same thing two completely different ways and mean the same thing. So that's a wonderful lesson.
Capturing the essence of that meaning and then broadening, the internal thesaurus, if you will, of how many
And so
different ways can I say it and still paint the same picture. It's a great exercise.
So we did this for a year and a half, about a year and a half. And some stragglers, sort of signed up at the last possible minute to get the grant. And keep in mind that a lot of people have, but I know at CHA, we have a tuition reimbursement. So the cost is not terrible for either of those tests. I think you can do both tests for under $500. And most places in the country, if you have tuition reimbursement, will be hovering around $900 to $1,200. So really, if you want to, you can do it. If you can pay up front, you're gonna get it back, hopefully, if you are working as a full-time interpreter for a health system. As a per diem, you will make it back. You will make it back in kind. And when people say, oh, I don't need that certification, I've been doing this a long time, please keep in mind that if your healthcare system gets acquired, you may be required to have that interpretation certification. If your healthcare system for some reason doesn't succeed and you're finding yourself having to go out and find a job, you may need that certification. As it turns out, I wanted to do some moonlighting as a VRI interpreter from home on top of my 40 hours that I put in. And I wasn't really able, I was able to do that at first, but then that company got acquired, and now it was required to have an interpreter certification nationally. So there I had this opportunity that was not afforded to me until I had that certification. So folks, listen up. First of all, it wasn't nearly as bad as I thought it was going to be. It was actually quite fun. The second one was a little less fun, because I got to see an hourglass of how long I had and how long I had been doing it. So that was a little different and it put a little bit more pressure on it, but I'm happy to say that I beat the clock. I was able to do both. I got high scores, higher than I thought that I would. And it really, it was one of those things where I was the one that was my worst enemy, my own worst enemy in that conversation. And it is, the CCHI tool is organized, the proctoring is organized, the accreditation is valid. And so I highly recommend if you were to, ask me, which one would you choose? I chose CCHI intentionally. So.
Thank you. Thank you. That will help so many people who are sitting on the fence with many of the same concerns that you
And
share.
listen, I have no problem including anyone in my free 90 minutes a week starting back up in the autumn months. So if you're interested, Eliana will give you my email address. You're certainly welcome to reach out to me and we can arrange something so that you feel more
Absolutely.
prepared.
So anyone listening to this podcast who wants to participate in Anita's training class, get in touch with us at trainers webinars or at info@nciHC. Both are .org, and let
And
us
it's
know.
not
And we'll
regimented. You can
connect you.
drop in, it's not a thing where, you have to be in class 1 and through class 10. It's not like that at all. And I think I'm going to be doing it every couple of weeks instead of every week now. But it's something that I'm certainly very open to talk to anyone about because I know that for me and for the other students, the study group was such an essential way in which we were able to feel so much more prepared. And I have to tell you, everybody who took it passed. So, folks,
Nice
that's
little metric to throw in at the end there. So
yeah.
this leads directly into my next question, which is looking forward. What are you most excited about, or what would you love to see happen? Because the times we're in right now are somewhat fraught, and it's really easy to cave into anxiety and fear mongering, but together we are stronger. And in that sense, if we take action, whatever small action locally in your neighborhood, at your school, at your hospital or local clinic, through an organization that's regional, through an organization that's national, I mean, the list is endless. Do something. That's also my advice when you have that frozen deer in the headlights moment when you interpret. Do something. Wiggle your toes, move your hand, get yourself out of that frozen moment. Take a step, take an action, and you will feel better. You will unfreeze. You will feel less hopeless when you're working for the things that you believe in together with other people who also believe those things. So, back to my
I'm glad
question.
you said it
Looking
that way
forward,
because
what are you looking forward to, Anita?
so there's a couple things that come to mind right away. So you were talking about fear mongering, and there was a lot of fear. There still is a lot of fear around how AI is going to take over and we're going to be obsolete and et cetera, et cetera. Frankly, I don't think that that's the program. The program that I am most excited about is to manage to figure out, and I just was able to start working with Gemini in my Google, sanctioned by my association, my organization, and I've also been hesitant, but I'm ready to dive into a little bit of Chat GPT, just to understand how it's working. Because what I see happening is that we take AI technology and human interpretation and work as a unit together to make it a better product, the better service, so that we who know can teach the tool and the tool's well, I can't say never, but it's certainly not ready for prime time so that it can take over for what we're doing. The nuances just aren't there.
Absolutely. And the
And
only way it's going to get better is with a human partnership.
that's right.
Right now, I think the things that are unchanging, like wayfinding, wouldn't it be nice to take all of those? How do I find, garage number 3? Where is the inpatient pharmacy? Where's the lost and found? I need to go fill out paperwork with the finance office. wayfinding. They could carry something around like they do in the museums
I
that,
mean,
you
look at
stop in
Google
front of the
Maps.
painting and it tells you all that information. You could just carry something in your hand that would tell you which elevator to take and what floor to get off on. And that would free up time for interpreters to be in those more nuanced situations that AI isn't ready for. There's so much room for collaboration rather than
Absolutely.
fear.
Absolutely. And it's hard to have a conversation with someone who's absolutely petrified that they're obsolete already and that they've got to put out the door because AI is coming any minute. I really try very hard to have them, take a deep breath and really look at the possibility of how we could actually design a model by which interpreters and AI can collaborate to make it better, that make the AI tool better, make the interpreter a better interpreter as a result. And I think that is one of the things that I'm excited to see roll out, however it's going to roll out. And there are some pretty brilliant people that are already working on that right now. Another thing that I'm very excited about during the COVID lockdown, I wrote a white paper on one of the ways, I call it a mindful moment, one of the ways in which to collaborate in telehealth. And one of the things that I did, because we're working in integrative medicine, so you've got your behavioral health folks and you've got your clinical folks, but often what we're doing nowadays with its integrative model is to ask leading questions in a clinical appointment that might lead to, I'll have to get back to you. Yeah, I'll get back to you. I'm sorry. Thank you. Yeah, thank you. Sorry. I told her that I was going to be on a podcast. Anyway, that was my landlady. So anyhow, where was I? So, what was I saying? I'm sorry.
The the crossover or the bleed
Oh, yes,
over between
integrative medicine.
clinical and
That's right.
behavioral health and
So these leading questions are specifically designed to see if there are any issues in the behavioral health area that one needs to be concerned about in that clinical appointment. And the same goes in a behavioral health appointment. They're asking leading questions about their physical health as well. So what I noticed was like I didn't know how to fasten my seatbelt. But I had this opportunity through telehealth to usually have a moment with the provider prior to including the patient, right? And in that moment, that mindful moment that I like to call, I would say something very simple. Today, I'm going to partner with you, and I would really appreciate understanding what your goals are for today, or if there's anything specific I need to be aware of so that I can prepare. So I can be ready to support you in the best way that I can. Very
yep.
simple. And it
No
adds
one ever
just a
says, no, I
second.
don't want you to support me, or no, I don't want you to do a good job when you
I
ask
mean,
for a
the
repetition so you can interpret properly. Yeah.
the most frequent response that I got was, "Oh my, no one has ever asked me that before. No interpreter has ever asked me that before." And I got it over and over and over again. And so I sat down and wrote a white paper. And then I reached out to a series of providers, many in leadership, who I had worked with as their interpreter, and asked them, what about this sentence or this introduction makes a difference for you? And then they wrote a small paragraph about their experience with that same theory or model of introduction. And as a result, it was publishable. It was bona fide. It was, and while I haven't published it, this is what I have done with it. And I may still publish it. And this is why, looking ahead, I'd like to do more of these. And that's what I was getting to. But what I ultimately did was send it to provider after provider after provider if the context allowed. So let's say we worked really well together and they said in their closing, wow, that was a really great experience. I would say, well, thank you for partnering with me and thank you for allowing me, to understand where you were headed with this appointment. Would you like to see a short paper on the subject? And they would say yes. So I have managed to send it to the like chief of psychiatry, chief of medical director at some and such and such. And when the context allows, I'm able to send this really great paper that shows how powerful it can be for the interpreter to step up and take an initiative like simply retooling the introduction to be able to give me more information without having to say something like, I'd like to do a pre-session. That's very daunting, especially when you've got 35 people on your docket for the day and you're already late, right? You don't want to do a pre-session with
Yeah,
someone. But if you
pre-session
just
sounds
roll
so
it in
formal.
there,
Is there a doodle poll? Like, what do I have to do now? Yeah.
yeah, no, exactly. So it's just, oh, may I ask you, what your goals are today and what's the best way that I can support you? Is there anything that I need to know about this patient?
And then you start out aligned. That's the
Yeah.
beauty of that. Yeah.
Exactly. And they weren't stressed about a pre-session. They weren't stressed about, having to take extra time. I mean, my vision in the world would be that every single patient, every single provider, when you're switching over to the next patient, they do 1 minute of mindfulness exercise to clean the palate and begin again. That goes for the patient who's been rushing to get to the doctor and is nervous about what's going to happen today, and the doctor who's delayed and hoping that this person doesn't take too long, all those things with 60 seconds of just grounding, right? But we're not there yet. So maybe I'll introduce that in some future universe. But for now, I'd like to do more of these papers about the kind of experience that we have as interpreters and what we need to be paying attention to instead of just being the voice box at the other end of the line.
Well, Anita, in any future universe, especially when it comes to communicating to different beings, I really hope that I will get to experience it with you as part of that universe.
Thank you so
Thanks,
much.
everybody, for joining us today. I had a blast learning about your career arc, and I am so happy that you shared your concerns and your success, your triumph
May I
after
add
40
one thing,
years. Yes, go
Eliana?
ahead. Go
I am
ahead.
a visual artist and I have been doing visual art for a number of years now, all of which I do simultaneously while interpreting. And what I discovered, thanks to Vanessa Costa, who told me that in meetings, it has been proven that those who doodle versus those who note take actually retain more of the material. Well, guess what? Once I started drawing while interpreting over the phone, and with the exception of the INR and all the things you really do have to take the notes for, I was able to extend my retention. I was able to extend the time that it took for me to retain and then turn it back over. And I was able to remember so much more. And I was much more focused. So, something to be said, and more to come. I've been encouraged by a number of people to perhaps do a workshop on just that, that uh, side of the brain that doodles is the brain that actually has the linguistic experience and knowledge. So
Just
thank
your
you.
creativity
Right.
combined with professionalism,
Absolutely.
combined with thinking out of the box,
Mhm.
combined with facing your fears, and most of all, introducing mindfulness
That's
to
right.
everyone. That 60
And thank,
seconds, that breath before you start, all of that, so that we can, as aligned, get so much more done in so much less time. Thank you
that's
so
very
much,
true.
Anita. It's
No,
great,
thank you for the
great.
opportunity. I really appreciate it. And thank you to all of the interpreters and the interpreter leaders. And that includes you and all of the folks that are bringing this association forward. I really appreciate everyone. And I'm so proud to be working alongside all of you. Thank you so much.
Thanks, everyone. Thanks for
Bye
being with
bye.
us.